Hi everyone, welcome to TrainHR's live webinar on wellness plan incentives after healthcare reform. My name is Liz and I'm going to be your host today. On behalf of the TrainHR team, I would like to thank you for being part of this event. Today's webinar will be presented by John C. Garner. John is a founding principal of Garner Consulting, an employee benefit consulting firm in Pasadena. Under John's leadership, this nationally recognized consultancy has built a broad base of services including benefits consulting, claim audits, and compliance for insurance companies, employers, healthcare organizations and providers, and managed care companies. Garner Consulting recently merged its insurance brokerage division with two other brokerage firms to create Wellness Benefits, where John also serves as a principal. He has spoken to many industry organizations, including the International Society of Certified Employee Benefits Specialists, the International Foundation of Employee Benefits Plan, and the Employer Healthcare Coalition of Los Angeles. John earned his BA from Occidental College and holds several designations, including Chartered Life Underwriter, Certified Employee Benefits Specialist, and is a Certified Flexible Compensation Instructor. We are really honored to have such a distinguished person, such as John Garner, with us to present this webinar. Ladies and gentlemen, before we begin, I would like to inform you of the program outline for this training session. This webinar is for 60-minute duration. First, John will take you through today's webinar, highlighting the area that will be covered, and he would then share with you his presentation. I would also like to inform you that all participants, once they are part of this teleconference, have been placed on mute and will remain so until the Q&A begins towards the end of this webinar. This is for the purpose of avoiding discontinuity and for allowing the presenter to speak clearly so that everyone present can take maximum benefit from this webinar. I also request all to hold back your question until the Q&A window begins. 10 minutes of time will be allotted for the Q&A, during which your questions will be answered. And if for any reason you get logged out of this training session or teleconference, I request you all to follow the same procedure to join in again. Now that we are all ready to start, I request John to take it from here. John.
Thank you, Liz. I want to add my welcome. I hope everyone's having a good day, and I look forward to your questions at the end. Here's what we're going to cover today. We're going to talk about the old wellness plan rules. We're going to talk about new definitions. We're going to talk about the rules governing the amount of financial incentives that are allowed under wellness plans. And we're going to talk about state laws and other federal laws. And then we'll go through some action steps, and then we'll take your questions. First, let's talk a little bit about why employers offer wellness plans. The main reason is to reduce benefit costs. And that's not just health benefit costs, but it's also disability costs and workers' compensation costs, because healthier people are less likely to have on-the-job accidents and illnesses and more likely to recover quickly when they do. They can also reduce the number of grievances and in general promote a more effective use of the healthcare system. But rather than just focusing on benefit costs, what I've found is that wellness programs actually reduce absenteeism and increase productivity when they're effective. And so employers see bigger savings from increased attendance and productivity than they do from reduced benefit costs. We've had rules about financial incentives or disincentives under wellness plans for a number of years. These are referred to as the HIPAA Rules. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. And these rules applied to plans that had any kind of financial incentive or disincentive. And the reason for the rules is that HIPAA says that an employer-sponsored group health plan cannot eligibility on health status related factors. And they carved out an exception for bona fide wellness plans. And so in order to be a bona fide wellness plan, the financial incentive related to a health factor had to be limited to 20% of the cost of coverage under the HIPAA rules, had to be reasonably designed to promote good health or prevent disease, had to allow at least an annual qualification. And therefore, if you had a reduced premium for non-smokers and someone was a smoker initially, they could come back to you later and say, I'm not a smoker anymore, and qualify for it. And we'll talk more about that. Plans also have to provide reasonable alternatives for people who have a health condition that makes it impossible to comply with the program that applies to most people, and we'll talk a fair amount about that. And there are also disclosure rules. You have to tell people about the program, tell them that there's reasonable alternatives, that kind of thing. Healthcare reform basically took the old HIPAA rules and put them into law rather than just regulations, with one major change, and that has to do with the amount of the incentives. And we'll talk about that in a moment. And we also have new regulations now governing wellness plans. And these regulations have a lot of new definitions. And first of all, let's talk about the definition of financial incentive, because a financial incentive is to be construed broadly. It could be a reward. It could be a penalty. It could be a discount of some sort. It could be a rebate of some sort. It could be a waiver of cost-sharing requirements so that if you do something, you get a lower deductible or a lower out-of-pocket limit. It's really any kind of financial incentive. Think of it broadly. It doesn't include things like giving people coffee mugs or T-shirts or hats. Those are de minimis. But if they're going to get money, it's a financial incentive, whether they get it directly or indirectly. One of the new definitions we have is a definition of a participatory wellness program. And if a program meets this definition, then everything I'm talking about today doesn't apply. In order to be considered a participatory wellness program, there either has to be no reward or a reward not related to a health factor. So, and we'll go over some examples in a moment of what a participatory program is. In order to qualify as a participatory program, it has to be available to all similarly situated individuals, regardless of health status. And if it meets these criteria, then you can have whatever financial incentive you want. It could be 100%, not limited to any percentage. So examples of this would be I don't know how that word "no" got in there, a fitness center reimbursement program. So if you just say, hey, anybody who's enrolled in our group health plan, if you want to join the gym down the street, we'll pay your membership or part of your membership. No strings attached. They don't have to prove they're in good health. They don't have to prove they go to the gym. That would be a participatory program. Or if you have a reward for having diagnostic testing done, regardless of the outcome, then that would be a participatory program. And this is a fairly common approach. A lot of employers offer biometric screenings, and if there's no rewards attached to it, just, hey, know your numbers, you're going to be in better health if you know your cholesterol and your blood sugar and your high blood pressure or your blood pressure reading to make sure it's not high, and there's no reward, then that's a participatory program. Or you could give people a reward for participating in a smoking cessation program, regardless of whether or not the individual quits smoking. So you could send out the message, hey, smoking's bad for you. We don't want you to smoke. We will give you $50 if you go through the smoking cessation program with no strings attached. They don't have to quit smoking. That would be another example of a participatory wellness program. So hopefully you get the idea. The rewards are not based on